go. Okay, Ohima, welcome. I have a special guest for you today. I am here with Eleanor Joseph, who is OHIMA's longest standing active member. And I wanted to capture our special chat here to share with the membership. And I'm Jill Choi. I'm on the member engagement committee, and this is a treat. So, Eleanor, let me start off by saying, wow, you take the top honor of being Ohima's longest active member. So, tell everybody, how many years has it been? Like, when did you join?
Hi, Jill. Thank you for inviting me. I didn't realize that I was the longest active member until you called.
Yes.
I started working in medical records in 1963, before Medicare,
Oh,
before Roe versus Wade,
oh.
and a few years later, I earned my ART from the American Association of Medical Record Librarians.
Yes.
Now, that organization was about 39 years old then. January 67, I came to the state association. Not very active, but at least I was a member. But it was not called Ohima. So
Right.
I don't remember what it was called, but that was 55 years ago.
Wow. And when I talked to our executive director, she was thinking it was like the American Association of Record Librarians, or you were thinking maybe it was Ohio Association of Record Librarians.
Yeah, the
Record
national is
librarians back then. Record.
Yeah, the national is American Association of Medical Record Librarians.
Yeah.
And back then, the medical libraries in the hospitals often fell under the director of medical records.
Oh,
How
wow.
about so that they did think of us as like a library. We're sorting records,
Yeah.
and we do more than that, don't we?
Yes, you sure do. So we're
55 years ago.
50. That's amazing. That's amazing. And um, you're retired now, right? And you're out of the
No, I'm working.
oh,
I'm retired.
you're out of the hustle and bustle. So what have you been up to since you retired?
Well, I live in senior housing, and residents here have taught me many card games. So I that keep busy with playing cards. And on Sundays, I lead game day. So I've played Tripoli, Bunco, Yahtzee,
Yes,
and a lot of other games.
love it.
We do have educational lectures here, nights, some musical entertainment. And I am one of the leaders of the monthly book club. For the first time in my life, I'm reading something besides health information management.
Yes, Eleanor. Yes. Well, that's
So,
great.
yeah, but him has always stayed with me. It's a profession that can go anywhere with you, and it helps you in life too. I still get asked questions about Medicare billing and HIPAA guidelines because, that's important to the residents here.
Right. That's right.
For 8 years, I took minutes of the management forum here, and people would tell me the minutes are, I have a tape recorder. I'm now resident counsel.
Very good. You got your tag on there?
Yes.
Yeah.
And it was started. I've held numerous positions, president again, and now I'm secretary. What do you think? Records remember, people forget. Do they still say that in
Oh,
him?
yeah. Yeah.
Our resident council represents the Association of Residents here, just like Ohima represents our Ohio members. So both organizations are here to help.
That's right. Those are like transferable skills, right?
Isn't that
Yes.
wonderful? Yeah, exactly. Thank you. Transferable skills.
Right. So even though you're retired, you're still a member of Ohima. Like, tell the members why that's so important to you.
Yeah, I'm still a member because when I first retired, I wanted to know what Ohima was up to.
Yeah.
And I have also a lot of peers, friends, other professionals that helped me in my career. So I wanted to know, are they on the board, national? Where are they? What are they doing? I looked for their names. And of course, I try to vote national and state,
Yes.
especially if I recognize names. Now, our state association was always a leader. I wanted to know what new challenges we were facing
Ah,
and
yes.
if you were still a leader since our information management is expanding. You
Yes.
know, in the past, Ohima won many national awards um, for various things, and I just wanted to see that Ohio was still tops.
That's awesome. So you're still tapped into our association. But I bet you it's changed a lot since you first joined. Can you tell our listeners like how different it was back then?
Well, for one thing, as we said, we were called record librarians, and then we were called Ohio Medical Record Association. And here I have my Ohima shirt.
Oh my God.
On the board, we decide to a moneymaker. So I still have my polo Ohima shirt. The
Beautiful.
annual meetings were held all over the state: Cincinnati, Dayton, Cleveland, Toledo, Columbus. So it was kind of nice to go around. You didn't have to travel so much. But we got an executive director, and she did the conventions of hotels.
Yeah.
And it was just more convenient to be in Columbus. So we were at the Hyatt, the convention center, for several years. And then when Easton was built, that was very pretty. And they
Oh,
decided to hold that permanently. And I still believe that's where you hold your annual meetings.
yeah.
Um, we were, I've got to get this here.
She's got props, folks.
I've got
Got some
props.
props.
On the board, we started DQRC,
Oh boy, DQRC.
Data Quality and Reimbursement Council.
Ooh.
We were to help people on this council were like one from each local, and we were helping locals and us start a coding council, roundtables,
Yeah.
coding roundtables. We dubbed our name Code Busters.
Yes. Okay, Eleanor, what are the codes on that page right there?
I knew you were going to ask me that. I think one is consulting. It's a CPT code.
Mm.
And this other one, I think, is something crazy like
Oh God.
history of mental illness or something.
Okay,
It's a,
all the
it's
coders
a
get out.
V code from ICD-9 and
Yes, that's right.
CPT. And believe it or not, this DQRC answered coding questions from our members around the state. And because Ohima was a leader, the American Hospital Association had not started coding clinic yet.
Ah,
Now, so see, we were helping out our members. So this is why I feel Ohio's always a leader. You know, I know you do Zoom and other kind of state things, but Ohio, I'm impressed, and I'm
yes.
a believer, and I feel so good about Ohio. This Codebusters also planned coding seminars at the annual meetings. We didn't have web pages, we didn't have internet, we didn't have Zoom.
Oh,
None of that was available. But yet our roles were changing into privacy, quality management, revenue cycle, DRG payments.
yes.
And then our annual meetings became really famous for the quality of programs, the number of vendors and booths that we had. We started getting attendees from other states.
Yes.
Many of our board members went on to the national scene, which I'm very proud of, all the different roles they played there. And even I went and helped to write coding questions for the exams.
Wow.
So that was fun.
Wow. So how about Ohima in general? How do you think Ohima impacted your career when you were working?
My local association was where I started, going through the ranks and being officers and everything. So that helped me to advance to work with the state association. I learned a lot from the peers on the board. They worked in different settings, different roles, so a variety of leadership. Ohima gave me confidence, knowledge, support, and opportunities for professional growth. And I made a lot of friends around the state.
Yeah, I feel like I want to go like this. Heart that. Oh, I can't do a heart.
Please, yeah.
Heart. Oh,
Heart.
heart that. That's
So,
awesome.
yes, I guess it was, yeah, heart. Lovely.
How about special memories that you have about OHIMA, or do you have any other props? Anything you want to
I
share?
already mentioned Code Busters.
Yeah.
That's a real one. And I told the executive director that she better not retire because she was talking about that during my presidency. She was so much help. I don't know how I could have got it done without her and the whole board. There's a lot to do when you're president.
Yeah.
The award I received in 2003.
Nice. Professional Achievement Award in 2003.
Right.
What
And
was
with all my credentials.
I was going to say, wow, look at that.
So those are really special memories. And then, of course, they sent me as delegate to the national convention. And that meant a lot to me, too.
Oh, that's awesome. Okay,
My props.
so let's go back to where it all began. How did you become interested in this field of HIM?
Well, in 1963, March, my friend got me a job at the hospital medical records department.
There you
So
go.
really, I never thought about it,
Yeah.
but without credentials. But then I had a boss at that time, Barbara Shelley, registered record librarian,
Ah,
who was for education. And I start thinking, if I'm going to be working, might as well get some credentials and, move on forward. So back in the day, as you said on some of your questions, back in the day,
yeah.
the American Association of Medical Record Librarians started a a correspondence course. I took a correspondence course and it made me eligible to sit for the exam. In the 1970s, Cuyahoga Community College, Tri-C, finally was introducing an ART associate degree program. They had a board of medical record directors. We still were called medical record directors. And I was on that board. They needed faculty just to help and get it started. And I taught medical legal aspects. And I followed some of those students, which was kind of nice
Ah,
as their careers expanded. I worked at the Visiting Nurse Association in their intake department, so I learned another role for HIMers.
yeah.
I liked expanding my knowledge of all the different roles. I remember as director, I was implementing computers for the department. So some of my staff felt they wanted raises since computers added so much extra work for them. So that's how we thought of it in those days.
Yeah.
So you never know how your staff feels about changes. Next my last job was directing a coding service for the Greater Cleveland Hospital Association. We used to code charts, I would say, right before perm file. They're all complete, everything's done, easy to code. But when DRGs are coming out, the health care, Medicare was always trying to control expenses.
Oh, yeah.
They were blaming hospitals for increased spending. I remember during Nixon's time, he froze our salaries.
Oh.
Yeah, for a whole year.
Oh.
And that didn't work really. So DRGs were one of the first things that came out to control. But then that meant you had a code at discharge or even start coding while the patients were there. So this was a big change in processes for hospitals. So the coding service was there to help members, hospital members, with their backlog, excuse me.
Yeah.
And so the coding service was timely, helped members out. I don't know, to me, I always wanted to help, whatever it was. That was in me. So teaching or whatever, I wanted to help. I began conducting coding seminars, auditing medical record documentation. I love this job because it gave me an opportunity to travel around the state to a couple states nearby, West Virginia, Pennsylvania, Michigan. And I went to work with doctors, nurses, health information management professionals, vendors, all different kinds, teaching them various medical record science. Because of the variety of roles, I never got bored in this job.
Yeah, you will not get bored in this profession.
No, staying in one position, this was just a lot of fun. Then when HIPAA began, I started conducting privacy seminars. I love to joke around. I passed out hippopotamuses. Now they got little ones, but this is mine. Hippos for HIPAA. So you remember HIPAA by hippos.
How cute.
Love it. Like I said, even some of my coding seminars, I passed out dollar bills, fake ones, but still to show that they're coding for reimbursement.
Right. It's awesome.
These privacy seminars at HIPAA, the strange things, we have a code of ethics or code of conduct.
Yeah.
So we always protected patients' privacy. But the rest of the hospital or doctor's offices didn't seem to do it.
Yeah.
So the government creates HIPAA.
Yeah.
If they had let us run the world, no.
There you go. That's right.
There you go. Yeah. So how can you get bored with a profession that has so many different aspects? Then I taught coding at Lakeland Community College, coding at Tri-C. And as I said, I really wanted to help students. Some of these were doctors' offices, staff. I wanted to see people grow. I never thought of it as a job. This is my profession. I earned as many credentials as I could, especially in coding.
Yeah.
So I have an ART, RRA, CPC, CMC, CPHQ, CCS, CCSP. Some are from Ohima and others are from different organizations. Okay. And then I went on and got my master's in public administration, majoring in healthcare administration.
Awesome.
So I believe if you're going to teach or be an expert, get the extra credentials in your areas. It makes you feel good that you can pass a test.
Yeah.
Of course, mine never fit on my business card, but that's another story. But the master's degree and my years of experience allowed me to sit for the RRA exam. No longer was it librarians.
Yes.
So I felt I was always in school, always learning. I didn't read books. I read federal registers, state regulations, Commerce Clearinghouse, and whatever else.
Ugh. The federal regulations, the Federal Register. Oh,
Yeah.
okay. Out of all that history, can you think of like what was like your biggest challenge when you? I know there's so many, but what do you think was the biggest change or something in our profession that you dealt with?
Well, there was just so many. But I think technology.
Oh yeah,
We were doing everything manual.
there were
Master patient index. I had these whole huge
the
holding
Eleanor, the
what?
Lectriever. You know the little Lectriever where you put your MP,
Yes,
your oh, they're like the
that
battery
wasn't so
card.
little. It was huge, but
Yes,
yeah, everything was manual. If we wanted to research some disease, we went to the manual. So I guess it was more like a librarian if
yeah,
you think of all those manual kinds of things. So technology, electronic medical records, our medical records were 100% paper,
yeah.
different colors. Your progress notes were yellow and medications were blue and so forth. And then the coding assistants, coding encoders started. We were coding from books for years and years.
Three
And
volumes.
then
I remember 3 volumes.
3 volumes, yes. And
Yeah.
then toss in CPT. So you've got 4 code books that you're juggling. Voice recognition. I remember going out of state to a company that was brand new with voice recognition. So to me, it was, wow,
Yeah.
this is fascinating. And now nobody thinks anything of these things. Another big impact was the federal regulations. Excuse me.
Yes.
Um, I don't feel that we were so controlled early on in the 60s.
Oh my gosh, it sure has changed, hasn't it?
Yeah, there's more federal regulations now, more watchdogs. The federal government does recognize our profession. Remember when Hillary Clinton was working on healthcare costs and reimbursement? She brought in our national organization. And I thought that was great. That was a winner. International work, another change. I had a friend that worked in Saudi Arabia. Now,
Mm.
you talk about doing something different in medical records. And she was there quite a while. And then I always said I would retire before ICD 9, 10, I'm sorry, ICD 10. I started with standard nomenclature of diseases and operations. Then there was something like HICD 8. And then I went to ICD 9. And
Oh,
then we had CPT. And then all the payment changes, DRGs, APCs, RUGs, all these were trying to control costs.
yes.
And there was a different type for each healthcare service. So if you worked in skilled nursing facilities, home health care, inpatient, outpatient, physicians, of course, I like to learn it all. You had to learn all these different things. So that's a lot in those, well, a lot.
That's a lot.
But all those payment systems to control healthcare costs.
Wow. Well, with so many years in the profession, all the change that you've encountered, what advice would you give HIM professionals today on managing the change or just career advice in general?
Well, as you see, I kept learning.
Yeah.
Um, Lifelong learning. I'm a big believer in that. You can't stay where you were. Lifelong learning. Read, learn. I don't know how many federal registers I have read over the years. Ohima offers many programs and seminars. Expand your knowledge, keep up with the changes. You can't stay where you are.
Yeah.
Think about when you graduated from high school. If you stopped learning, I mean, you'd be useless, right?
Yeah.
You've got to grow with our evolving profession. The roles have changed and people have changed. I mean, what a difference. And then please become a leader. Volunteer for your local, your state, national.
Yes.
That is so meaningful. Peers from around the country are a wonderful source for information sharing. There's already one of our members that has found a solution to something new.
Yes.
And to discuss it with another person, you help each other out. So that would be my general recommendations.
That's wonderful. And as we wrap things up, Eleanor, a lot of young professionals are watching. Any final words of wisdom that you can leave us with?
It's a profession. Never think of it as a job.
Yes.
You're entering healthcare, which is a service organization. This means you are supporting others, even patients. What you do affects many others. There are so many opportunities and so many different roles. You have a wide range of work settings, even around the world. Lifelong learning, it doesn't end at graduation. And have fun.
Wonderful. Did you hear did you hear this? You take this away, you hug it, you think, "Wow, look at look how many things you've done." This was just perfection. Thank you so much for
You're
spending
welcome.
the time to share and take us down memory lane. It's just been fabulous, and congrats on your longest standing Ohima status because it's fabulous. It was just an honor to talk to you. Well,
Thanks,
that'll do
Bill.
it. That'll do it. You're so welcome. I'm Jill Choi from the Membership Engagement Committee, signing off until next time. Thank you again, Eleanor. And everyone have a wonderful day. Toodaloo, wave to the camera, Eleanor. Bye.